This lecture is on blood flow through the heart. Now, the thing I want you to understand about this is that I'm going to put some diagrams on the board, and I'm hoping that once you understand how this works, you'll remember it forever because you'll understand how it works. So here we go. Remember, you're looking at the person's heart, so this is the right. Here's the right-hand side. Here's the left-hand side. I'm going to draw my heart diagram here. So here we have the two atria. I'm giving some room so that I can label things. Move that down a little bit, actually. Give myself a little bit more room at the top. So here we have the two atria. Here we have the two ventricles. So to start off, we have blood flowing into the right atrium here. So it's coming through two large veins. Here's one, here's the other. And in all cases, there are valves, which I'm simply going to symbolize this way with a symbol that looks like that. All that's doing is symbolizing those sorts of one-way doors that you see in hospitals where the two doors kind of meet like this, so that in fact you can go one way, you can walk through the door, but on the other hand, then when they come shut, you cannot walk in the other direction. That's not what heart valves look like, but it's how I'm symbolizing them here. So what we have then, here we have some one-way valves, and here we have blood. This is oxygen poor blood, so I'm symbolizing it with blue. And so here we have oxygen poor blood, deoxygenated blood, then, from the lower body. And this big vein here is called, since it's from the lower body, this big vein here is called the inferior vena cava. So that's the name of the vein. Here is the blood, and now it is flowing into the right atrium. And then we have oxygen poor blood from the upper body, so from your head, arms, and chest then. So this then is in the vein called the superior vena cava. So here we have that blood then flowing in, flowing through this one-way valve and collecting there in the right atrium. Okay, so here then we have, as I said, oxygen poor blood from all of your body except for your lungs flowing into the right atrium here. And then, of course, the atria contract. Remember, the atria contract first. And then what happens is that this oxygen poor blood then flows through another valve. Here's my valve again. Flows through a valve. The atria contract, and all of that blood then flows into the right ventricle. And, of course, remember that when the atria contract, this blood gets squished into the right ventricle, and it cannot go backwards. That's what these one-way valves are about. The blood cannot go back into the veins, and the blood cannot go back into the atrium. So now we have blood there in the right ventricle. Then, remember, the ventricles contract. So at this point, what happens is that at the top, then, of this ventricle, we have an artery. A big, important artery, and it goes off at kind of an angle, like this. And again, there is a one-way valve there. So the atria contract, squishing blood into the ventricles. And then the ventricles, in this case the right ventricle, then winds up contracting, and this blood winds up getting pushed into this artery here through a one-way valve. So here we have the blood exiting the heart and going through this artery here. Expand that a little bit. So remember, this is a diagram. This does not reflect the true size of things, but it's going to give you an idea. So we have this oxygen poor blood leaving the heart and going to the left and the right here. So what is this big, what is that big artery called there? That then is the pulmonary trunk, right there, which then divides up into this and this, which are the right and left pulmonary arteries. So here we have the right and left pulmonary arteries. And what do? They bring blood to your lungs. So here, as I said, we have the right and left pulmonary arteries bringing blood to your lungs. So you're going to then have this blood going to the left lung, that blood going to the right lung. So keep in mind, all this blood is still oxygen poor. That's why I have it symbolized with the blue ink. And all of this blood is flowing in one direction when all the valves work the way they should, so that you have this one-way blood flow through the heart coming from the upper and lower bodies with the oxygen poor blood, through the right atrium, through the right ventricle, out the pulmonary trunk, to the right and left pulmonary arteries. Yes, these arteries have oxygen poor blood in them. So the right and left pulmonary arteries, they will bring the blood to the lungs. And of course, at the lungs, what's going to happen? The blood is there going to pick up the oxygen. So now we are going to have a look at what happens after that. So then, at the lungs, then, the blood picks up oxygen, and the oxygen-rich blood then flows into pulmonary veins leading to the heart. Okay, so we have the blood picking up oxygen at the lungs and then flowing into the pulmonary veins. Anytime that you see the word pulmonary, you're dealing with something having to do with the lungs. So the pulmonary arteries go to the lungs, the pulmonary veins come back from the lungs. And now we are going to get this diagram again. Okay, so now we have blood coming back from the lungs. Now what I'm going to do here actually is I'm not going to draw in the various pulmonary veins. I'm simply symbolizing this with one. There are actually numerous entries to the heart, to the left atrium, but what I am doing here is this as a diagram. So here now we have oxygen-rich blood from the lungs. And this now is in pulmonary veins, like so. So again, the blood flows from the pulmonary veins then into the left atrium. So we have the blood collecting, and I think you can kind of see how this is going to go now. It is the same concept as happens on the right-hand side. So again, we have a valve. Between the atrium and the ventricle, here's the valve. So the blood from the lungs has been slowly flowing into the left atrium. The two atria contract. At that point, the blood can't go back out this way because we've got a valve there. So the blood gets squished down into the left ventricle. So this blood now leaves the left atrium, goes into the left ventricle, like so. So here we have this lovely oxygen-rich blood now in the left ventricle. Then what happens, of course, is that the ventricles contract. And then there is another big artery exiting from the top of the ventricle here. So here we have an artery here with a one-way valve. And when the ventricles contract, then this blood winds up exiting the heart. So it leaves the ventricles, does not go back into the atrium, and instead this oxygen-rich blood leaves the heart. So here we now have the blood going to the heart. It's full, or the blood coming out of the heart. This blood is now full of oxygen. So here we have oxygen-rich blood going to all of your body tissues, your brain, your toes, your knees, your liver, all of the different places. We are now getting the oxygen-rich blood that will bring oxygen to all of your tissues, except the lungs, of course. So oxygen-rich blood going to the body tissues, except the lungs. And the name of this big artery now is the aorta. So that is the aorta. The aorta is the largest artery in your body. The aorta then is the first artery right out of the left ventricle, and that then ultimately is the supply of all of the oxygen to all of your body tissues, head, arms, feet, toes, everything in between winds up being supplied with blood that started there in the aorta. So that then is blood flow through the heart. Once you understand it, you will remember it forever. And the only other thing that I want to get to, and by the way, remember there is a one-way valve here. And so again, the blood does not get to go back into the left ventricle so long as the valves are all working. The only other thing that I want to just briefly mention is the question then of what happens at the body tissues. I just want to briefly bring up the concept of blood vessels that are called capillaries. So at the capillary level, blood goes from arterioles gas exchange takes place, and then the blood flows into venules. We will do more about this when we are talking about the tubes of the circulatory system, but because people will sometimes ask, okay, so blood is in arteries, blood is in veins, what happens in between? And what happens in between, where the real action takes place, to be honest, is at the capillary level, where you have blood flowing from arteries into ever smaller arteries until finally you get down to microscopic blood vessels called capillaries. The blood flows through capillaries. That's where the real action takes place. That's where gas exchange takes place. That's where nutrients are distributed to your tissues and so on. And then after the blood has flowed through your tissues in these tiny blood vessels called capillaries, then the blood collects in venules and goes to veins and so on. But the capillaries, in many respects, are kind of the most important part of your circulatory system and what connects this whole idea together. So that then is it for blood flow through the heart.